Do you feel like you're working as hard as you can to brush and floss, and yet you still get food stuck in between your teeth, struggling to find a way to get those areas of food out? Well, I'm Dr. Scheurer from Tranquil Dental, and we love trying to help our patients to find the way that works best for them to get that food out. So of course, we're always stressing how important it is to brush and to floss, but on occasion, you'll have those areas where food will get stuck. And even the brushing and the flossing seems like it won't remove all of the food that's in there. And so there are lots of different tools that you can use, and some are as basic as a toothpick to try to get that food out. But there's also other types of tools, like there's an end tuft brush, and an end tuft brush looks just like a toothbrush, but it's like about 3/4 of the head of the toothbrush got chopped off. So it's a much smaller brush and comes to a point there. So if you're trying to get to that food, you can actually use this small end tuft brush right up at your gum line in between those teeth and kind of give it a little jiggle or a little wiggle there and pull down the same way that you would with your toothbrush. But because it's so pointed, it helps to get into those areas. And of course, you can do the roof of your mouth side too to pull down there. There are other tools that are like interproximal tools to get in there to get those areas where your food is stuck. And so one of them is really tiny, really small, and it has like these little tiny projections on them. That are like little bits of rubber that are in there that help to grab onto the food and the bacteria and pull it out. So you can just take that, let's see here, and put it right in between the teeth, and you just kind of push it and pull out, and that'll help to get the food out. And again, you can do the same thing on this side. And if you need to, you can actually bend a little bit and go right in there at an angle. One of my favorites though is actually like a little Christmas tree. You can have this little Christmas tree brush on a toothbrush handle, and they have just the small segments that'll go and attach to it, and you can use it that way. This is actually a travel sized one, and I love this one because not only is it handy to keep in your pocket or in your purse, but it has a little lid that'll go on, and if you take the lid off, this is the brush. And so it's like a little Christmas tree shaped brush that has all these bristles, and you can take it and just use the bristles, and you can just push in and out from that area where it's kind of impacted, the food's in there, to help to remove that food. And you can do it from the other angle too. But one of the reasons that I like this the most, and I think it's really neat, is that instead of the brush just staying in that position, because it's a travel size and much smaller, if you take your fingers and you rub them back and forth, it'll actually change the direction of the brush. So if I pull or push, it changes it to 90 degrees. So if you could imagine if this was somebody's mouth, they've got their cheek here. And so it's a little hard to come straight in if you're working on a back tooth to get to that area. But of course, if you change the angle, then you can come beside the cheek and get in there and do the removal. So it's really important that whatever tool you're using, you're making sure that you're getting all that food out, because any food that stays in place, the bacteria that are in your mouth naturally are going to feed on it, and then they're going to produce products that are going to cause decay. And the other problem with that is that any food that stays there irritates the tissue and breeds bacteria in the area, different bacteria from the ones that cause decay, but it'll actually cause gum disease. And through the process of gum disease, your gums will bleed and they'll get puffy and swollen. And then of course, following that is bone loss. So really, really important that you're making sure that you're getting all of the areas of your teeth clean. So you can start with your toothbrush and your floss, but if you find that there's areas where you're getting food impacted and stuck and you're having a difficult time getting them out, make sure that you find the tool that'll work best for you in your hands so that you can make sure that you keep all those areas clean.